Why is the OCTA research group now taking the lead in calling for lockdowns? Is this a voluntary move by the OCTA research group, or is this I have to say it, sorry, orchestrated action on the OCTA research, government, etc. para mapaghandaan ng tao mentally yung magiging lockdown?
Yeah. Very valid questions. Alam mo naman tayo dito, we're very transparent dito. Wala naman kami tinatago sa iyo. And we have said repeatedly in this program, we do this for public service. Bakit kami nauuna magsabi ng we do research, yes. We analyze data. We've been doing this for more than 1 year. May mga nagsasabi, hindi naman kami eksperto. I would disagree. Actually, I would say na, kami yung nakakita ng trends that some do not see. Hindi ako nagmamalaki. Sinasabi ko lang based on the history. I mean, noong nagkaroon tayo ng surge no March, we were alerting everyone. February pa lang. It's documented. Nasa media, nasa interviews, nasa news, nasa online. Na we saw the surge coming and we wanted to act on it early. And we did not act on it early kasi reactive yung response natin. So we are very concerned kasi we're seeing the same signs ngayon, telltale signs. And we saw that mga 2 weeks ago na. When there was the first confirmation ng local case na Delta variant, we were very concerned, sabi natin. In fact, we had an interview before. So sabi natin, let's prepare for that. Ganon. I mean, kami, of course, we're not the government, we're not the official government body, or we're not even the official government na nagre-recommend sa government. It's the IATF and the Department of Health. Kami, we're an independent research group monitoring these things. If we see na nag-alert naman yung government or yung itong mga concerned institutions, hindi na kami kikabo because, that's what we want. We want to help. If they're alert to this, fine, okay lang, walang problem. Bakit kami nangunguna? It's because we're not seeing any proactive moves right now, and we're doing our public civic duty as Filipinos because concerned tayo to inform the mayors, inform the and they listen. I mean, yung mga Metro Manila mayors natin, they also see this kasi they have people on the ground. We see this in hospitals na nagkakaroon na ng increases in cases. We're seeing this in the LGUs. They're telling us that they're having increase in cases. We're seeing this in the numbers on Department of Health. So this is being confirmed. So yung lockdown, I mean, that's a suggestion. It could be any type of intervention. Ang sinasabi lang natin right now, what we're seeing is the interventions that we have are not working to the best it could be kasi tumatas pa rin yung cases. Yan lang naman, yun yung sinasabi natin. So based on the numbers, dumadami pa rin cases, so maybe we have to introduce more interventions. If they don't want lockdown, they can introduce something. Yes, we're just giving our suggestion kasi, I mean, if we crack our brains, ano pa yung pwede natin gawin? Testing, tracing, lahat, we have thought about everything, so ito yung masasuggest natin. We can't be reactive lang to the present situation. We have to be more proactive. Yun yung ina-argue namin.
Okay.
Let's look into the future. Let's think ahead and plan this ahead instead of pag dumating na and the position right now, and I understand this is the position of the Department of Health. They're basing it on healthcare utilization. Pag dumaming nasa hospital, then they will lock down. But we can't wait for that to happen. Kasi pag dumaming nasa hospital, that means the situation is also already very bad. Which is what we did exactly last March. Hinintay natin dumami nasa hospital. Ang dami na ng cases, umaapo na. And I don't even know how accurate yung hospital data na because based on their hospital data, it says 70% utilization. Pero on the ground, what we hear is yung mga tao, they can't get into hospitals. They have to go to, region 3, region 4, or outside to get hospitals. I'm very transparent. So sasabihin ko naman na it would be earlier than nung March. So hindi naman tayo aabot pa ng I think hindi pa naman tayo aabot ng 4,000 cases by August 15. But it will be later than nung last year. So it's somewhere
Okay.
in between. So it's not very, very late, but it's not. But we would prefer it earlier para mas maiksi. Because if we see it coming, why not do it now instead of waiting and then do it later? Parang yun lang yung point. Talagang may trend na increasing. So even we waited mga 1 week later. So ngayon, we still have a window. We can wait siguro 1 week. And I say that, and it's okay if the government wants to wait and see na, ay, tumataas nga talaga. But
Yeah.
if we wait 1 week, then 1 week, and if we see the rise in numbers, dapat we should be ready to put on the brakes or whatever we have to do. So okay lang sa akin yan. Let them see the numbers that we're saying will happen, and then let's react. Pero August 15 might, yung 1 week na yun, that could add 2 weeks of lockdown. So I'm just saying based on sa numbers na nakikita natin.